Hey, I'm Dr. Mark Rosenberg, and today I'm going to talk about tennis elbow. We have a lot of muscles in our body, and I often talk, if you refer back to my other videos, about adhesions between muscles. When there's repetitive use, it doesn't have to be tennis. It could be mousing on the computer. It could be the way you open up your car window. Does anybody have crank windows in their cars? No, probably not. Any repetitive use can cause an adhesion between the muscle because you're always using it in the same pathway. So the muscles glide along each other, they get fatigued, they start to tighten up, and you can get adhesions, which can then lead to scar tissue. So the treatment for tennis elbow, also known as radiohumeral epicondylitis, and I'll explain that in a minute, is to break up those adhesions. This bone up here is called the humerus. The bone on the thumb side of your arm is called the radius, and the bone on the pinky side of your arm is called the ulna. So the joint is between those three bones, okay? These two and this one. So radiohumeral, okay, because we're talking about the radius and the humerus. Epi, which means about. Condylitis. Conda means articulating surfaces, and itis means inflammation. So it means an inflammation between the surfaces of the bones. However, something has to lead up to that. It just doesn't happen out of the blue. And like I said, it's usually repetitive use. So what happens is that most people do nothing. They put it in a sling, or they wear one of those straps around it to immobilize it, and they just don't feel the pain, but they're not dealing with the problem. So let's talk about the problem. These muscles here need to be dug into. So I'm going to hold my arm up, and you can see here, my arm's developed. Okay, I'm going to dig between these ridges. Now, I don't hold the arm tight when I dig. I keep it relaxed, and I dig. And I dig. And this is very similar, by the way, to my shin splint video. In fact, that's where I got the idea from. I never had this problem, but I started working on patients. And then one day, from repetitive use, I got it in one of my arms and I fixed it. So I'm showing you how to do it. So you get in here and you dig. And if you find a spot in particularly painful, it might actually make your fingers go numb. Actually, it's kind of funny. If you press on the tendon, you could actually move your fingers a little bit. It's kind of funny because you're contracting the tendon, if you like that kind of stuff. Anyway, so you get in here and you dig, and there's several, as you can see, there's several places where you could do it along here. I'm not going to get technical with the muscle names because it doesn't really matter for your intents purposes. And along here, get in there and dig. So my thumb is on the other side. I'm just stabilizing, but you want to dig here. Okay, and it's not going to take once, I'll tell you that. It's going to take 2 to 3 times a day for multiple days to get some result. In fact, it could take for weeks. But what else do you have to do? If you're in pain, you'll do what it takes to get out of pain. So go in here and you dig. Okay, then after you do that, okay, you take your hand flat and you pull up, kind of like you're kneading bread. And again, we're trying to break up these adhesions. So first, very specifically, and you may find, like I'm doing this right now, and I worked yesterday and my arm's a little tired. Right here, it's more tender than right here. Is it the beginning of an adhesion? I don't know, maybe. So I'm gonna go in there and I'm gonna dig. I'm gonna dig, and then I'm gonna spend time. But after that, you pull this away. Okay, and you're pulling this away, and then your arm's feeling a little looser. Now, don't get crazy with this move, but I'm going to show you how to do it. You take your arm and you hold it straight. You put your hand underneath your elbow. Can you see that? And you tighten up the tricep muscle, which is back here, but nothing else. Watch. You might get a little click out of it. I'm not trying to thrust and crack my elbow. What I'm trying to do is gently contract my tricep muscle and pull these back into alignment. Now, some of this is age. If you're older and you hurt your elbow a long time ago and there's arthritic growths in there, sometimes there's minimal things you could do besides rubbing the muscle. But if you're not in your 60s and 70s and you haven't damaged your elbow and you just woke up and you have this pain, by all means, you could try this move as well. So again, just to review, dig, find the spots, and go along the whole length of where you see these lines between the muscles. Pull, and then tighten the triceps. Now, here's another little strategy as well. After you get done with this, you could put some ice on it and rub it, or hold it, bring some inflammation down. Another strategy to do, and this could work very well, is to heat your arm up first with either a hot shower, a hot tub, or Epsom salt bath, or soak your elbow. Get it hot and warmed up, and then do what I just described, followed by, when you're done, ice. So again, this is not a treatment that you're going to do once and it's going to make it go away. We don't know how long those adhesions are there, either the doctor or the patient. Even if it started on Tuesday and you went to some health professional on Wednesday, you could have been working on it for the past 2 or 3 years. There are lots of variables when you're taking care of yourself. And again, you could mask the pain, you could take drugs, you could take all kinds, but you got to fix the problem. And you want to get in there and you want to move things around. So again, this is very similar to my shin splints video. In that case, though, the tibialis, the shin muscles, adhering to the periosteum, the covering over the bone. Here, with radiohumeral epicondylitis, tennis elbow, the muscles are adhering to each other. And by the way, one of the positive signs of tennis elbow, one of the tests, somebody's holding your hand and you turn this way or turn this, while they're holding it, it brings on the pain. Okay. If it doesn't bring on the pain, it could be coming from your neck, and your neck could just be misaligned. You just need adjustment. So that's a little differential diagnosis for you. Okay, if you have any questions about it, shoot me an email. Or actually, better, just leave me a comment underneath the video. Also, my books are available. The links are below. Thanks for subscribing to my channel. There's a lot of information here, and sometimes questions are asked. I just refer back to the video. I'm not pushing you off. It's just, it's been covered before at length, and I can't write a long thing in the comment section. All right. Have a great day. Bye.